right, so today we're going to be administering blood to Mr. John Smith, and Mr. Smith has a hemoglobin of 7%, his hematocrit is 20%, and so he requires this blood. In addition, knowing that he's going to be receiving blood, I have done some assessment, and he is pale, he's complaining of some shortness of breath, and he has had positive YX stools ×3. Good. So the first thing we're going to do is go into the room, do some assessment with Mr. Smith, and see that he's ready to receive this blood transfusion. I'm going to take some supplies with me. I'm going to take some blood tubing. I'm going to take a flush alcohol wipes and a bag of saline, a 500 milliliter bag. All right. Hello, Mr. Smith. My name is Michelle, and I am your registered nurse today. I understand you need to receive some blood today. Your hemoglobin and hematocrit are low. I've reviewed your orders and your chart. I'm going to just verify your name and date of birth. So we have John Smith, 8778. I see you have an IV site that was started by one of our nursing students today. So I'm going to assess that site. I also see here that as I was reviewing your chart that you have signed a consent for this blood, and it's been witnessed. So we have a blood consent. Okay. At this time, I would answer any questions that Mr. Smith has about the blood transfusion. All right, so at this point, I'm going to put on some gloves and assess this IV site. Okay, so I see there's no redness or swelling. He denies tenderness at his IV site. I'm just going to flush with a little saline to make sure that this site is patent. And this is flushing easily. Are you having any discomfort? I see no swelling. I'm going to flush with at least 5 mL of saline. And I know this IV is patent now and ready to go. Some of the assessment I would complete now. I've looked at labs. I've told you some of his assessment data. I've also listened to his lungs. I want to make sure and know at a baseline what his cardiac and respiratory status are at, should there be any complications once this blood transfusion is initiated. I'm also checking because I know for the first 15 minutes he's going to be in bed for sure as I'm monitoring, so I would ask him if he needs to use the restroom or anything before we begin. And all of those things check out just fine. So at this point, after that assessment, I'm going to prime the blood tubing. Blood tubing is good for 4 hours from the time we start the transfusion, and the unit of blood as well. We don't want it to hang for longer than 4 hours. So the first thing I do when I take any tubing out of package is close all my clamps. Understanding what needs to be open when is important during blood transfusion. So I'm going to just close everything. Now we're going to spike our 500 ml of saline. And it doesn't matter which one of these we use, okay? So I'm just getting some blood down into my chamber. And now I'm going to open and just prime this tubing through with saline. And if I lose a little bit as I'm priming, that's okay. This is just a flush bag. I won't use the whole bag of saline. Okay, good. So the tubing is primed. I am going to leave this tubing ready now, and I'm going to get the blood from the lab. So I'll be back in a few minutes, Mr. Smith, and when I return, I'll have another nurse with me, and we'll do some verification of the blood, and then we'll get that started for you. Okay. All right. Okay, so at this point, another RN or registered nurse needs to check the blood with me, so thank you, Alyssa. This is Mr. Smith. We'll just go into his room and get ready for this here. So come on over. Okay, I'll just put on some gloves because I'll handle the unit. Okay, Mr. Smith, we're back, and this is Alyssa, and she's going to go through checking this blood with me so we can get this started. So at this time, I would have either myself, while I was getting the blood, or a nursing assistant check his vital signs so that I have his current vital signs before starting the blood. And this is the paper we'll use. Okay. So we're going to verify information from the unit, from the lab, and from his name bands. Okay. So first we have John Smith. John Smith, and you can read that to me down here.
Okay. John Smith.
All right. And his date of birth is 8/7/78.
8778.
Okay. His medical record number is 123457.
123457.
Very good. Okay, we have unit number 0049093.
0049093.
Okay, we have blood band number 0002009.
0002009.
All right, and now for the rest of the unit, the patient is B positive.
B positive.
The unit is B positive.
B positive.
The antibody screen for this unit of blood is negative,
Negative.
and it is compatible. It expires tomorrow. Okay, thank you very much. Okay, following the verification process, now I'm going to I'm ready to spike this unit of blood, and so we'll continue with that. All right, before I spike my blood, I'm mindful that the clamp on my saline is closed, okay? Okay, at this point, I'm going to open the clamp on the blood. The saline remains closed. I'm opening the clamp on the blood. I'll squeeze the chamber. And now I'm going to open the tubing and allow this blood to flow until I have some pink start to show at the hub. Okay, I don't want to lose any of the red blood cells, but I do need to prime this down to the hub. And Mr. Smith's lung fields were clear bilaterally on auscultation. His vital signs are also within normal limits. His temperature at this point was 98.8. Okay, and now I have pink down to the hub. So at this point, I'm going to connect this to his IV. All right, and I will tape this IV to his arm so that it is secured during the transfusion. Okay. At this point, I will put my IV tubing in the cup. Mr. Smith was just admitted, so he is a new patient. He is on the medical surgical unit. And I'm going to choose under Guardrail IV fluids. I'm choosing blood products. And in this case, he is receiving packed red blood cells. Okay. I'm going to initiate this blood transfusion at 100 milliliters an hour. And I'm going to fix my volume at 25 milliliters. And then I'm opening my clamp and I'm going to start this blood transfusion. Okay, so the 25 milliliters will transfuse within the first 15 minutes. During this 15 minutes, I'll remain with my patient. I will watch for any signs of a transfusion reaction. In talking with my patient, I'll let him know to tell me if he notices any itching, any pain in his back, or otherwise any shortness of breath. I'm therapeutic in the way I communicate to my patient as I'm assessing. I don't want to cause fear and anxiety, but I want to let him know, to let the nurse know if there's any changes he's concerned about. So during these 15 minutes, I'll do assessment. I'll complete my documentation on the blood administration flow record, including what I've hung the blood with, what gauge of needle he has, or IV catheter he has. Mr. Smith has a 20 gauge, and for an adult, we like to see a 20 gauge needle or larger, so 20, 18. In a pediatric population, or in some adults, when you're unable to initiate an IV larger, a 22 would be just fine, even a 24 in a pediatric patient as necessary. I would complete documentation on this form, and I've signed my verification of the blood with the other RN who checked with me. Okay, so at this point, we have reached our 15 minutes of the transfusion. So I'm going to pause my IV. It would start beeping at this point. I'm going to check a set of vital signs for Mr. Smith. And if his vital signs are all within normal limits, which his temperature previously was 98, his temperature at this point is 99. We watch for a 1 degree Celsius change, or approximately 1.7 or 1.8 degree Fahrenheit change would be concerning. His blood pressure, heart rate, pulse oximetry, respiratory rate all look fine. So I am going to increase the rate of his blood transfusion at this time. This blood transfusion, I'm going to set my rate at 200, and I'm going to put the volume remaining in, so he had a unit size of 300, he's had 25 go in, so there's 275 remaining. I'm gonna set it a little less than that, so that I have time to switch over to sailing, okay? So 275 remaining, I'm gonna set this for 240 volume to be infused. Okay, I've adjusted my rate, and I'm gonna start at this time. So at this point, I would make sure that Mr. Smith is comfortable. I would tell him that I'm going to be in every hour and we'll check vital signs. I'll do an assessment, make sure his IV site still looks fine, and make sure there's no issues occurring. I would have talk with my healthcare team, so if I have a nursing assistant, LPN working with me, so they know when vitals are due and to inform me if there's any concern. All right, so within an hour and a half, we enter the room and we see at that time that this blood bag is dry, okay? So at that time, I would close off the blood, the tube to the blood, and I would open the tube to the saline. If my IV is beeping at this point, I would set it for more volume, okay? So that I can let the blood clear from the tubing so he gets all of the packed red blood cells, okay? At that point, I will do a follow-up set of vital signs, a completion set of vital signs. And again, make sure that Mr. Smith is having no concerns with the blood transfusion.